Hello, amigos. Nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Lesson 63, carcinoid tumor, chest X-ray and CAT scan findings of pulmonary carcinoid tumor. Let's go. We're going to talk about the chest radiographic and CAT scan findings of pulmonary carcinoid tumors. Carcinoid tumor is sometimes called as just simply carcinoid. As we can imagine, the name of carcinoid came from the word carcinoma plus oid plus tumor. So the name is carcinoma-like tumor. The histopathology of this slide is the feature of a typical carcinoid tumor of the lung showing many rosettes, prominent rosettes. This is from the Wikipedia. Let's have a brief introduction about pulmonary carcinoid tumors. It is from neuroendocrine origin, and usually they show lower grade malignancy. So tumors are indolent in the course and infrequently metastasize. The predilection site is airway. The instance is rare and it is the second most common lung malignancy after lung cancer. Typical carcinoid represents up to 90% and the others are atypical carcinoid. It is divided by cytology criteria. The mean age of the patients are 45. The symptoms are usually from airway obstruction, such as cough, hemoptysis, and wheeze. Typical carcinoids are low-grade, well differentiated on histology. Up to 85% are bronchial location, and among them, 3/4 are lobar distribution, and up to 15% are peripheral in location and sometimes show iceberg tumor feature. Atypical carcinoids are less well differentiated and more aggressive than the typical carcinoid tumor. Radiologic findings of pulmonary carcinoid tumors. The first one is SPN, solitary pulmonary nodule, and second, obstructive pneumonitis. They are apt to be lobar location, so the features can be consolidation, atelectasis, and with mucoid impaction. And most importantly, usually they show strong enhancement on contrast-enhanced chest CT, and also they usually show poor or non-uptake, non-FTG uptake at PET-CT. These two features usually show strong suggestion about pulmonary carcinoid tumors. You gave me good and subscription. Thank you very much. Be happy, healthy, and wealthy. Let's enjoy and let's start the radiologic findings of pulmonary carcinoid tumors. First one, typical carcinoid, women age of 50. What do we see in the frontal radiograph? Yes, triangular, increased opacity, obscuring, obliterating right heart border, suggesting right middle-lobe collapse. And we can confirm it on the lateral film, right middle-lobe collapse. We see the triangular collapsed right middle lobe on these three films, and the mass is 3 cm in size. On your left side is non-contrast CT. On the middle, it shows strong enhancement on the tumor, homogeneous, strong enhancement of the tumor. And the last, PET-CT shows almost no uptake, no FTG uptake, no glucose metabolism of the tumor. Contrast Coronal CT shows the strong enhancement of the mass after contrast infusion. And on your right side, bronchoscopic finding shows endobronchial mass obstructing right middle bronchus. Second case, also typical carcinoid, small, less than 1 centimeter, small, typical carcinoid, 50 years of age, man, 2 years difference. At the beginning, it was 7 millimeter. Now it is 10 millimeter. It shows a small solitary pulmonary nodule. Although small, the second image shows the relatively strong enhancement of the small nodule, and the third image shows poor non-uptake of FTG. Usually, less than 1 centimeter nodule is not so accurate on PET-CT because of breathing movement artifact. Anyway, this PET-CT image shows no uptake of the tumor. Third case, carcinoid, atypical carcinoid, man, 50 years of age, left upper lobe solitary pulmonary nodule attached to left heart. Contrast CT shows a little contrast enhancement from 28 to 50 of Hounsfield unit, and also the PET-CT shows hot uptake. These findings are little different with typical carcinoid, because typical carcinoid usually shows strong enhancement on CT and poor uptake on PET-CT. But this atypical carcinoid is rather contrary to the typical carcinoid and somewhat similar with lung cancer. This is the last case of today and the most interesting case of today. Let's enjoy the imaging findings. What do we see in this old woman? Yes, triangular homogeneous increased density on left lower medial side means left lower lobe collapse. What do we see more? Look at the arrow. Yes, we see 3 centimeter round mass in the middle of the triangular shape. This is atypical carcinoid. We see the strong homogeneous contrast enhancement of the tumor and left lower lobe collapse at the axial CT. And also we see the poor, even no uptake of FTG at PET-CT. The tumor shows no uptake, no glucose metabolism with left lower lobe collapse, meaning endobronchial location. Yes, these two axial images are usual findings of a typical carcinoid tumor. Where have all the flowers gone? Do you like this song? Sung by Nana Muscari or Marlene Dietrich or other singers? Yes, the famous song. Where have all the Marlboro men gone? Yes, regrettably, many of them, most of them, have died due to lung cancer or COPD due to Marlboro cigarettes. Sir, you quit smoking? Yes, wonderful. This is the most wonderful job of you this year. Congratulations. See you soon.